conversation. So without further ado, I'd like to actually hand things over and get started with our first pitch, which is going to be ThriveLink, presented by Kwame Liddell. So let's all give a hand.
Hi, my name is Kwame Liddell, and I'm the founder and CEO of ThriveLink, where we build bots that talk to patients and enroll them directly into social programs like food stamps, utility assistance, and health insurance. We do this because I'm a nurse, and I worked in emergency departments. I jokingly say before become a travel nurse was so cool, and we care for so many families that didn't need more health care. They needed access to healthy food. They needed to be able to afford their medication and have stable housing. But 54% of all adults are not able to read strong enough in their native language to complete the process. In the US, this impacts 100 million people. It impacts 700 million people worldwide, because the gateway to free housing and food and these kinds of supports is paperwork in the United States and in the UK and most of Europe. But we completely changed the experience for patients. In a real patient experience in North Carolina, this patient had very serious clinical needs, but she could not miss work to go see a specialist because she had 2 young children and her utilities were going to be turned off. Instead, she used our bot, vocalized her answers, and she sent us this screenshot 2 weeks later where it paid her $519 utility bill. She didn't have to leave home. There was no additional work for the doctor. And the reason it worked so well is because our user experience was created so that anyone can use it. It works in 75 languages. There's no reading required. You don't need a smartphone and you don't need the internet. She was able to just dial a phone number at home. It's very simple. You just speak to our bot. It transcribes the answers into the appropriate application and sends it to the government. Here's a real study in North Carolina where 28 patients enrolled themselves into $20,859 in resources. That is real confirmed food stamps. That is, we calculate the actual dollars that they receive for their rental assistance and things of that nature. Similarly, at Boston Medical Center, we did a study with people over 65, and 76% of them used the platform, and they submitted over $50,000 in resources on their own. This was impossible before ThriveLink. And when you really think about it, the point of care when you're at a doctor is just a moment in time. But if those patients are able to navigate into those resources, as you can see here, they receive resources for years on end. ThriveLink, when we think about how we've grown, we launched in January of this year. We have partners in 8 states. We have supported over 900 patients and delivered over $2,500 in resources. When we think about the future of ThriveLink, we are not a healthcare company. We're an accessibility company that takes people along the journey to get the resources they need. So think about all of these social programs, but licenses, taxes, passports. As we continue on our journey, we ask this group, of course, for the things that are on the screen, but one of the biggest opportunities is that hospitals in low-income communities have a hard time implementing infrastructure. So we're looking for partners who can go with us to the communities who need it most so that we can implement our infrastructure into emergency departments across the country. Thank you.